Thank you, Lynn. It's nice to see a familiar face, and she actually gets credit with recruiting me to this program.
Yeah, I won't name the other program. It's on the 3rd floor of the A wing, but I thought that she might be happier here.
Thanks. All right. I'm excited to share today an integral part of my practicum within Vancouver Coastal Health's regional prevention team, working with the regional lead for early child development. It was an exciting place for me to work because I also am a public health nurse within the authority. And so to work at this level and have a really good understanding of how public health services are delivered, I think it really helped expedite my learning within this placement. I'm going to discuss the initial quality improvement steps that Vancouver Coastal Health has made towards consistent quality practices within early childhood development public health nursing practice. It has been identified that inconsistent practices are provided across diverse settings throughout early childhood development services in British Columbia's health authorities. Regional work initiated within Vancouver Coastal Health Authority includes the Early Child Development, or ECD, pathway that I developed over the past 8 months, and has provided an opportunity to promote universal early childhood development services that ensure vulnerabilities within children are identified in a timely manner in order to offer enhanced support. Firstly, it is important to acknowledge that the Public Health Agency of Canada has recognized that healthy early child development is a key social determinant of health. This includes the physical, social, emotional, and language cognitive domains of development, which strongly influence well-being, obesity and stunting, mental health, heart disease, competence in literacy and numeracy, criminality, and economic participation throughout life. Furthermore, the Human Early Learning Partnership, based at the University of British Columbia, has committed to research that identifies where children are living faced with adversity, as well as heightening the importance of early child development. My practicum experience also allowed me to work closely with Vancouver Coastal Health's population health team that has been directly involved with the collection and dissemination of early childhood development research within the Health Authority. Through the BC Ministry of Health's Healthy Start Initiative, surface statements define public health services for the family health, 8 weeks to 2 years phase that should be routinely offered by regional health authorities across the province. Child health service statements for the 2 to 5-year-old range are currently under development, and I had the opportunity within my practicum to provide feedback within the initial environmental scan of public health service delivery. Finally, the Early Childhood Development Project work aligns well with Vancouver Coastal Health's strategic framework. Its lens is people first. Vision, we will be leaders in promoting wellness and ensuring care by focusing on quality and innovation. And the mission, we are committed to supporting healthy lives in healthy communities with our partners through care, education, and research. The BC Ministry of Health recognizes that public health provides a key role in the service delivery continuum of interdisciplinary child health services via the Healthy Start Initiative. Universal services for women and their families include screening and assessment, health promotion and education, and intervention based on public health priorities identified for each of the prenatal, postpartum, and family health phases. The Early Child Development Pathway specifically addresses and supports both Universal Statements 3.1 and 3.3 with routine contact provided by public health nurses within the early childhood population. It offers the services within this population offer screening and assessment, health promotion and intervention, as well as the necessary print or electronic resources to further support caregivers' understanding of child health and development. It is important to highlight that enhanced services are provided where vulnerabilities and interventions are identified based on the level of need, risk, and strengths or protective factors. The intent of these services is to reduce inequities and promote health through the purposeful provision of enhanced services to those who may be identified as vulnerable. The development of regionally consistent services and clinical practice is a key strategic goal of Vancouver Coastal Health, and therefore, the senior executive team has recently approved the Community Clinical and Systems Transformation Project. This project aims to enhance best practice workflows and standardize care planning processes across the region of Vancouver Coastal Health to ensure that consistency within and across programs is met, as well as to promote utilization of quality data to support evidence-based practice, clinical decision-making, and operational program planning. For this reason, the Vancouver Coastal Health Regional Prevention Team has committed to quality improvement initiatives within the early childhood population that supports integrated interprofessional care planning processes across public health programs. Because of this keen interest, there is an understanding across VCH of understanding the early development research and trends within the region, the effects of child development vulnerabilities, and identify actions that can be taken to further screen for, address, and support these children living with vulnerabilities. The Regional Public Health Nurse Assessment Working Group was created to review and develop structured documentation within digital health systems. This task, guided by a clinical nursing care pathway, has been found to address standardized language for assessment and interventions, illustrate trends within patient status, and promote prompt documentation as only variances will be communicated. Structured documentation is an essential consideration for striving towards quality and consistency within nursing practice, and it can be achieved when these assessment norms are established within an agency, such as through practice support documents like the Early Child Development Pathway. The assessment working group supported my practicum within the Vancouver Coastal Health Regional Prevention Office as we focused upon the current early child development practice and the development of the regional practice support documents to ensure consistency and quality was being met. The National Institute of Health and Clinical Excellence is recognized as an international leader for developing practice guidance on public health issues related to disease prevention and health promotion. It provided an ideal process for developing the quality appraised early child development practice guidance for Vancouver Coastal Health. An assessment has also been, or is currently under development for public health nurses. However, the supporting comprehensive and very extensive nursing care pathway that I created that was just completed a few weeks ago will be instrumental in the assessment that will be provided to the nurses. These documents, along with revised practice standards, aim to ensure universal and enhanced family health public health services are provided as described in the Provincial Perinatal Child and Family Public Health Services document. The pathway guides public health nurse assessment, interventions care, and documentation for children 6 weeks to 5 years of age, which follow consecutively from the Perinatal Services of BC Newborn Clinical Nurse Pathway. It identifies the goals and needs of children based on inquiry and observation of the public health nurse within respective development milestones. Vancouver Community Public Health Nursing Model, which has been adapted from the Minnesota Public Health Intervention Model, aims to clearly define the roles and responsibilities of the public health nurse within the infant, child, and youth program at an individual, community, and systems level. Each section of the pathway identifies the norms and normal variations, education and anticipatory guidance, variances, interventions, and resources for both families and public health nurses. It brings strengths to the interventions that public health nurses provide through early childhood development practice, such as capacity building, care coordination, health education, screening, and referral and follow-up. So just to give you an idea of what the pathway looks like, it is currently divided into the following sections: physiological, growth and nutrition, development, health follow-up, safety and injury prevention, behavior, and family health. And this is what it looks like. It's available online through Vancouver Coastal Health's intranet. It's digitally friendly with clickable links throughout the document. It's broken down within the developmental sections, as well as further broken down within age-specific groups. And as you'll see, the resources that are provided are specific for families that can be easily disseminated, as well as specific resources for public health nurses. And on the last slide, you can see that there's general information and documents, there's provincial level, and then there's specific to Vancouver Coastal Health. The next steps towards ensuring quality improvement within the early childhood development programs will require the pathway to be shared across regional public health teams in Vancouver Coastal Health alongside universal and enhanced early childhood assessment guidelines to support the public health nursing practice and documentation. Consultation and feedback from the regional teams and leaders after using the pathway to support the practice over the next 6 months. That's currently what's just begun. And the plan is to then share the final early childhood development practice documents and guidelines provincially for further review and potential adaptation via the Perinatal Services BC. Finally, evaluative research will be conducted to confirm the effectiveness of delivering the universal enhanced services to the early childhood population. I want to extend my immense gratitude to my regional lead and my supervisor, Joanne Woldridge, and the entire public health nurse assessment working group. And I'll just close on a quote that I think sort of sums up the work that I'm doing. The world doesn't change one person at a time. It changes as networks of relationships form among people who discover they share a common cause and vision of what's possible. This is good news for those of us intent on changing the world and creating a positive future. Thank you.
Indeed, together make a difference, right?
Yes.
Thank you, Kristen. Questions, comments? And I feel our public health nurses going, yes, yes. Go.
Hi, thanks for your presentation. I'm curious with the guideline, it's a great resource that you've put together with lots of links. If there's any thought given to how you're going to keep that up. So as the documents change and evolve and as work happens provincially, have you given that any thought?
Well, because my time, unfortunately, is up with the Regional Prevention Office, although I would have loved to have continued there. For now, and because it's under review and consultation with the teams, it's in the hands of my supervisor at the regional level. And so she's going to maintain it, and as different sections and content are revised, I'm happy to support with the formatting because it was pretty extensive work that was done. But definitely, right now it's being termed a living document that can be adapted, and then I think definitely that needs to be part of the plan going forward.
Yeah, and just a little plug, not to forget Child Health BC for the provincial review for that piece.
I would love, and also shared at that level. Yeah, definitely.
Thank you, Shannon. Other questions, other comments? Oh, yep, thank you.
Thank you, Kristen. Just about the documentation necessary for evaluating what the outcomes are. Can you just speak to that a bit? Because I think you guys are on Panorama as well.
No, actually at Vancouver Coastal Health, we're not on Panorama.
Okay. So you've got your own system for documentation. Can you just talk about that a bit? Thanks.
Yeah, I'll try and do a short answer to that because there's been extensive dialogue within the Health Authority about how we're doing that and what our expectations are and the liability behind what needs to be documented and what can be included and supported from the pathway. And so that's, I'd have to say that that's going to be more part of the rollout, examples of case studies that we can utilize, and what the expectations will be for the public health nurses within documentation. Yeah, I'm not. I think it's an ongoing issue that's been evolving. So yeah, I just have to say that the appropriate attention is being given to it. Yeah.
Okay, thank you so much,
Great.
Kristen. I really appreciate
Thank
it.
you.